Hello, my name is Angie Neal, and I'm the Speech Language Pathology contact for the South Carolina State Department of Education. This presentation is for South Carolina's Speech Language Pathology staff. It is on the topic of speech sound disorders. A huge thank you to Marie Ireland from the Virginia Department of Education for her original presentation on this topic. The information this presentation is based upon comes from the most current evidence on the topic. It comes from the article by McLeod and Crow entitled Children's English Consonant Acquisition in the United States, which reported consonant acquisition of 18,907 children. It did not separate boys from girls. It noted that most consonants were acquired by the age of 5, that all consonants were acquired by the age of 6 to 6'11". It used a 90% criterion, and it found that these findings echoed the cross-linguistic findings of the McLeod and Crow 2018 study across 27 languages that found that children had acquired most consonants also by the age of 5, meaning that regardless of the language, most consonants were acquired by the age of 5. Another article from 2020, Evaluating Children in U.S. Public Schools with Speech Sound Disorders, Considering Federal and State Laws, Guidance, and Research, examines the use of new current norms in conjunction with IDEA and state requirements, and reminds us that a disability under IDEA should not be determined based on standard scores alone. Current evidence is important to consider as speech-language pathology is an evidence-based practice. As an evidence-based practice, we must rely on rigorous and up-to-date information. Quality evidence regarding typical consonant acquisition is essential because we use this evidence in our assessments, our diagnosis, interventions, and decision-making regarding eligibility for services. Now we're going to talk about 4 important topics. The first is the difference between educational versus medical identification. A clinical impairment or diagnosis is not sufficient for identification under IDEA. Clinical services are available for a fee, but schools do not fulfill prescriptions for services. Schools provide free services for those who are eligible and meet criteria under IDEA. Civil rights is another important factor to consider. Identifying a child as disabled who does not meet the federal definition of special education could result in a negative educational consequence. It is also a violation of the child's civil rights. Sometimes, if the teacher thinks the child has an IEP, that means they may think they are less capable and they may give them less opportunities or less rigorous practice. So it is important to remind teachers and others that this decision could negatively impact a child's education. There must be comprehensive, objective, and clear documentation that the student has an impairment and that the impairment has an adverse educational impact and thus requires specialized services in order to access and progress within the general education curriculum. It is also important that we address over-identification. IDEA requires states to submit data on every new disability in 5 disability categories. Speech-language impairment is one of those 5 disability categories. To determine eligibility and qualify a child as a child with a disability, the team must determine that number 1, the student has an impairment, and number 2, the impairment results in a negative educational impact and thus requires specialized instruction in order to access and progress in the general education curriculum. As a school SLP, you work as part of an interdisciplinary team that uses a variety of assessment tools and strategies. in order to gather developmental, functional, and academic information. In South Carolina, the requirements include all of the federal requirements. There must be documentation of an impairment, documentation that the difficulties are not the result of socio-cultural dialect or limited English proficiency. There must be documentation of an educational impact. There must be documentation of the need for specially designed instruction, which relates to that need for the stimulability in speech sounds. And there must be observations in the educational environment. And there must be adequate hearing and vision. IDEA prohibits the use of any single measure or criterion for determining whether a child is a child with a disability. That means that using normative data alone is inappropriate. Evaluations for speech sound disorders under IDEA should document the speech sound disorder using current normative data, as well as documentation of the educational impact and thus the need for specially designed instruction. When thinking about making evidence-based eligibility decisions that comply with federal and state regulations, it's important that you, as a school-based SLP, have awareness of what those federal regulations are, that you know the South Carolina regulations, and that you are aware of the South Carolina guidance and resources that are available to help you. There's also evidence in our professional literature, like the 2 articles that were mentioned previously. South Carolina regulations have specific criteria, and we have guidance that will help you stay in compliance. Let's take a look now at how to document an impairment. You can use a standardized test, like the Goldman-Fristow or another standardized assessment. You can also use a sound inventory if you have a list of words or picture cards that allow a student to produce sounds in initial, medial, and final positions. Another way to document impairment is to do the percent of consonants correct. We'll talk more about this in a few moments. Here's a picture of our speech production assessment summary. This form is part of the SLP Companion Guide. It will help you organize information from the academic setting, including tests and measurements, and the SLP probe data and tests and measurements. You will see that the speech sound inventory, documenting the number of sounds that do not meet normative data, and the percentage of consonants correct data are represented on this form. Now, let's think about how to document educational impact. It's important to remember that educational impact could be either academic or behavioral, social, emotional. Let's look at the ways that we can document academic impact for reading and spelling or behavioral, social, emotional. Whether it's intelligibility or social emotional issues, that data is going to come from our classroom environment or a combination of classroom data and SLP data. It may come from a writing sample to show how sound errors show up in spelling. It could be teacher data to show how reading comprehension issues arise from mispronunciation of words. It could also be SLP data looking at phonological awareness, which is one of the essential components for reading. It might be classroom screening and assessment data coming from items such as the DIBELS, Ames-Webb, MAP, or SC Ready. It might be intelligibility data coming from the parent, the teacher, or peers. Of course, you can also document student and teacher interviews that help reveal social emotional concerns, lack of participation, or even feelings about speech, language, and communication skills. SLPs can also document data from the classroom using their observational data. Let's talk more about phonological awareness. There's a great deal of research on the connection between speech impairment and phonological awareness. Many children with speech sound disorders have reported difficulties with literacy-related skills, most specifically with phonological awareness. In fact, if more than 10% of the child's speech has atypical errors, the child is likely to have deficits in phonological awareness, reading, and spelling. Phonological processing, which is word reading and phonological working memory, those skills have been shown to be weak even once the speech sound disorder is remediated. And the majority of all poor readers have an early history of spoken language deficits, with 73% of second grade poor readers having poor phonemic awareness or spoken language problems in kindergarten. How does phonological awareness have an academic impact? Well, phonological awareness is what allows us to compare words we know with words we don't know yet. For example, the words people and pupa, habit and habitat, session and secession, cumulus, nimbus, denominator, numerator. Hear how they sound similar? Hear how they sound different? But understand that if you don't understand how they sound both similar and different, how it might be tough to understand how the meaning would be different. Phonological awareness is also what allows us to repeat and to pronounce new, challenging, multisyllabic words like reconstruction, photosynthesis, and isosceles. And how difficult would it be to understand the meaning of these kinds of words if you couldn't pronounce them? Also consider the ability to hear syllable stress. The way we hear or verbally produce words using different syllable stress affects the meaning of the word. Take, for example, address versus address. One means a location and the other means the action of writing down a location. The word changes from a noun to a verb, and the meaning changes simply based on the stress of the syllable. But again, when students are not aware of these differences in the sound, then they are not able to make sense of how the meaning is different. Phonological awareness is also what allows us to connect the sound S with the symbols of the letter C or the symbol of the letter S. But if you only pronounce the sound S as the sound F, how likely is it that you will be able to easily make those sound to symbol connections when you are reading those letters or spelling using those letters? Difficulties being aware of the sounds of language result in difficulties understanding how the sounds of language are represented by those symbols. This leads us to talk about writing samples, specifically looking at how spelling in a writing sample is such a good tool for looking at academic impact, beginning at the third quarter of kindergarten, after letter sound correspondences should have been taught. Because spelling is highly dependent on an intact phonological system, therefore, when children have an impaired phonological system, like those with a speech sound disorder, it is likely they would experience difficulty with spelling ability similar to their difficulties with phonological awareness and decoding. This is a snapshot of the phonological awareness probe that is included with the SLP companion guide. This is to be administered by the speech-language pathologist. The speech-language pathologist can also use any other phonological awareness tool that they prefer, with one caveat. That caveat is to not rely on the overall standard score, but instead to look at what phonological awareness skill should have been developed by the appropriate age. Keep in mind that it is the higher level phonological skills of addition, deletion, manipulation, and substitution that are the most closely aligned with reading and connected texts. As we think about measuring intelligibility, one research-based method is to use the Intelligibility in Context Scale, or the ICS. It is a free parent report tool that's available in over 60 languages. It can help you quickly and easily document children's intelligibility with different partners. Again, this is a research-based method to document intelligibility that allows others to provide the data to you. Now, let's take a look at the need for specially designed instruction. How would you document that at your eligibility meeting? To determine the need for specially designed instruction, you want to be sure you examine a variety of data to determine if the child needs specially designed instruction to correct a speech sound disorder. We tend to think of this in three parts: the number of errors in relation to the current established norms, stimulability, and percent of consonants correct. Let's review some data sources to help you document the need for specially designed instruction. Let's discuss percent of consonants correct. This is a fast and imitative measure that was first described by Johnson, Weston, and Bain in 2004. The SLP Companion Guide has a PCC imitative measure form that will help you with this task. Another part of documenting the need for specially designed instruction is to look at stimulability. Sometimes this is included as part of your standardized articulation test, but the SLP Companion Guide includes the Missio probe to look at stimulability, which was something that was first introduced in the literature in 2002. You could also use a dynamic assessment to collect information about a child's stimulability. It is possible that if a child is stimulable and can imitate a sound correctly, they may not need specially designed instruction from a speech-language pathologist. They may just need guided practice and reminders from their classroom teacher and parents. Collaboration with teachers and practice programs can be provided to assist with this. Now, let's take a look at what some of these research-based tools look like. I'm going to show you screenshots of the PCC imitative task and the Missio probe. This is a picture of the percent of consonants correct imitative sentence scoring form. We have permission from the American Speech-Language Hearing Association to publish the directions and sentences. Speech-language pathologists can score a child's imitative sentences right on this form and come up with a PCC score to use in the summary. Here's a picture of the Missio stimulability probe. This can help you document when a child is stimulable. When a child is stimulable for at least 30% of opportunities, they are presumed to be stimulable and not in need of services. The Missio stimulability probe is an important part of eligibility decision-making in the state of South Carolina. Now, let's look at the speech sound norms. Here's a guide for the children's articulation and speech sound development based on the McLeod and Crowe 2020 norms. It describes the sounds that typically are acquired between the ages of birth to age 6.5. As you will see, the consonant phonemes b, n, m, p, h, w, d are typically acquired by the age of 3. G, k, f, t, ng, y were typically acquired between the ages of 3 to 4. V, j, s, ch, l, sh, z were typically acquired between the age of 4 to 5. V, j, were typically acquired between the age of 5 to 6, as do all other vowel-controlled R's, including R, or, ear, air, ire. And f was acquired by the age of 6 to 6.5. It is important to remember that all children do develop at different rates, even though there is a 90% criterion. However, there is a standard deviation for the McLeod and Crowe norms, which is 6 to 18 months. As a few points of clarification, errors of R, S, or L within a consonant cluster count as one error. For example, saying the word brown for brown, green for green, fwee for 3, quacker for cracker, prize for prize, drive for drive, frog for frog, street for street, all of those would count as one error. Also, errors of S or L in initial, medial, and or final position all count as one error. For example, white for light, balloon for balloon, ball for ball. Those would all count as one error. In contrast, errors of R in initial position and medial position that start the second syllable, that counts as one error. For example, wabbit for rabbit and pywit for pirate, that counts as one error. The reason for that is because R in the final position is a vowel-controlled R, and vowel-controlled R is a separate error from initial and medial position R. While there are 6 different vowel-controlled R possibilities, any vowel-controlled R error counts as one error. For example, if the child says car, but says gull for girl, door for door, then vowel-controlled R would be considered as being an error. Some individuals may ask what to do when a child is not eligible. First, it's important to be able to remind parents, teachers, and others that the requirements of IDEA are in place in order to ensure that students are provided a free and appropriate education in the least restrictive environment, and to protect the child's civil rights, and that there are differences between a clinical or medically based service and a school-based service, and that there are responsibilities incumbent upon schools to ensure that students are not over-identified as having a disability and missing instruction when it is not appropriate. Therefore, clinical services outside of the school setting are always an option that parents are available to consider. Many schools also offer multi-tiered system of supports. Through this program, an SLP may be able to offer indirect or direct support if a child is stimulable or in a situation where a child does not demonstrate an educational impact. Generally, there's a focus on home practice, and this occurs for very specific and brief periods of time, such as 6 to 8 weeks. Then the data is reviewed and additional steps are discussed. This type of intervention occurs only if a disability is not suspected, and this type of intervention may never be used to delay or deny an evaluation. Because this varies by district based on funding, each SLP would need to check with their school district regarding the ability to provide general education interventions. It is important that we also think about the clinical implications for school-based SLPs and how that may be different from other settings. School-based SLPs are required by law to consider multiple sources of data, and one source of data does not take precedence over another source of data. School-based SLPs have to document both prongs of eligibility, which are evidence of a disability as well as educational impact, and thus the need for specially designed instruction. Professionals outside of the school setting may not be aware of these differences, and they may indicate that a speech and language impairment is present in a child, but this does not necessarily indicate or may not be equal to having a speech-language impairment as identified or defined by IDEA, including the South Carolina guidelines for a speech-language impairment. However, when school-based SLPs do keep in mind the federal and state requirements, it can help with caseload challenges. The American Speech-Language Hearing Association has published admission and discharge criteria. This is another important point to consider as you're sharing information with private practitioners, parents, teachers, and others. There are some factors in ASHA's admission and discharge criteria that do align well with IDEA. On the left side of your screen, you will see factors such as when children are unable to communicate functionally or optimally across environments and with communication partners. You will also see that when it's appropriate to serve children in schools when there's a communication skill that negatively affects educational, social emotional, or vocational performance. There are some ASHA admission and discharge criteria that are not appropriate for use in schools. That includes failure to pass a screening assessment for communication. That is because it relies on a single source of data. This is why the South Carolina Department of Education no longer recommends the use of screening, but rather the use of observation. Through an observation and a collection of a variety of data, including teacher input and multiple sources of data, which are then discussed in a meeting similar to any other suspected disability area, the team can more effectively determine the strengths, the needs, and possible interventions. The other factor that would be inappropriate from this document is that the individual, family, or guardian seeks services to enhance communication skills. Enhancing skills is certainly a goal of most families, but it is not sufficient to call a child disabled under IDEA. There must be an educational impact and a need for specially designed instruction to be provided by the speech-language pathologist. Seeking just to do better or to improve performance is not enough. As a reminder, under IDEA means that we must have documentation that the student has an impairment and that that impairment results in an educational impact and that the child requires specially designed instruction to make progress. Remember, the federal regulations require school-based SLPs to work as part of an interdisciplinary team to gather a variety of data from a variety of sources. As you evaluate students and meet with families and teams, I hope that these considerations will remain in the forefront. The difference between educational identification and a medical or clinical diagnosis. The fact that civil rights issues occur when there is not documentation to support eligibility criteria. And of course, the understanding of over-identification and ongoing federal monitoring of every new speech-language impairment classification. Therefore, it's critically important to ensure that you have sufficient data to document each and every student suspected of having a speech sound disorder. Thank you so much for your time and attention and for what you do for students every day. Please know that I am available to answer any questions at any time.